Okay, I have broken down the wrist and hand into several different audio recordings. So I'm going to start off with the wrist today because this is a pretty long lecture. So I will try to highlight the most important parts. I also did use just a plain white background in the hopes that this would be a little easier to upload. All right, so as we look at the wrist, a couple of things to think about. We do have the distal radial ulnar joint, which has the two bones of the ulna and the radius, where they come together at the most distal end. That black area on here is something called the TFCC, the transverse fibrocartilage complex, and we will talk about that in class and that significance. But that is a picture there of where you can see the distal radial ulnar joint and the carpal bones and even the metacarpals 2 through 5. So triangular fibrocartilage complex shown here. You can see there's an area where it articulates with the ulna where there's this big space. And that is significant, as I mentioned before, when we see a Fuchs injury that would create a problem with a stretch in that area. I will describe that in class. So the movements at the distal radial ulnar joint are supination and pronation. You know that. We've already talked about that as well. This is kind of difficult to explain to you on an audio recording, so I will try to explain it a little bit better in class. But basically, as we look at the TFCC, this just shows how that TFCC becomes stretched in pronation and supination and can create some pain for somebody who has a Fuchs injury. The bones of the wrist, as we think about the carpal bones, they are the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. Some lovers try positions that they can't handle. I will not require you to know these in order, but we are going to talk about some specifically. For example, the scaphoid, which articulates with the radius. Let's see, in terms of what I wanted to talk to you a bit about here is just to talk a bit about the scaphoid bone. As you can see, that is the bone labeled S on the diagram here. It articulates pretty closely with the radius. Its literal name, scaphoid, means that it is a boat-shaped bone, and when we fall on outstretched hand, a Fuchs injury does tend to create a problem where the radius articulates with the scaphoid. The scaphoid is one of the most commonly fractured carpal bones. It's essentially in 60% of every fracture. It takes quite a excuse me, takes quite a long time to heal. And what would happen is we would need to have the person immobilized in a long arm cast or a splint for potentially up to about 4 months. It takes quite a long time to heal. The pisiform bone is a small little bone. I'm going to move my cursor around here, but I'm not sure that you can see what I'm doing, so I'll show you in class. Small little bone that sticks out in front. It's a sesamoid bone, and it lies actually within the flexor carpi ulnaris tendon. So we'll take a look at that. What else can I tell you? It acts to redirect the pull of the muscle to make it more effective. So much like the patella as a sesamoid bone did that, this pisiform is pretty important for some good mechanical advantage in the wrist as well. Before I go on, I just want to draw your attention to page 181. There's a diagram on there in chapter 12, 12-1, that shows the joints of the wrist. Um, Now, the more proximal end is where we see the radiocarpal joint, and the radiocarpal joint is the articulation between the radius and the carpal bones. Again, there is not a direct union between the ulna and the carpals. Now, the radiocarpal joint is a biaxial joint. That means it moves in 2 degrees of freedom. So we're going to see that the motions at the radiocarpal joint are flexion and extension, as well as radial and ulnar deviation. There's also a mid-carpal joint between the most proximal row of carpals and the most distal row of carpals. That's called the mid-carpal joint. That is non-axial. Then finally, at the distal end of the carpal bones, where they articulate with the metacarpals, we see the carpometacarpal joint, which is also non-axial. There are quite a few ligaments associated with the wrist area, and the carpal bones. You'll recall that ligaments are important for maintaining stability. So we have intercarpal ligaments, which actually connect all the carpal bones very tightly so that they're allowed to move but not excessive. I am not going to require that you know this, but there are also a number of ligaments that will attach the carpal bones to the radius and ulna on the palmar side, as well as on the dorsal surface or the back side of the wrist. All right, let's just looking at the more distal area that where the HC, TZ, and TP connect with 5, 4, 3, and 2. That is the carpometacarpal joint. Okay, the movements, as I mentioned, are wrist flexion and extension. We're going to take a look at some muscles that are responsible for flexion and extension. On the flexor side, we have the flexor carpi radialis, the flexor carpi ulnaris, and something called the palmaris longus that I'm going to talk about. So the flexor side muscles are going to be located on the palm side or the front surface of the hand and arm. For extension, we have the extensor carpi radialis longus and extensor carpi radialis brevis, as well as the extensor carpi ulnaris. Now I want to draw your attention to the names of these muscles. Makes them pretty easy to recall and to know what they do. Flexor obviously tells you that they flex. Carpi means they flex the wrist, the carpals. And radialis means that it's on the radial side. Ulnaris means that it's on the ulnar side. For the extensor muscles, same difference. 2 extensor muscles of the wrist on the radial side and 1 on the ulnar side. Here you see pictures of those. Extensor carpi radialis brevis, extensor carpi radialis longus, and these arrows are not lining up well, so disregard the arrows, and extensor carpi ulnaris, which I will show you more effectively in class, or if you take a look at the regular PowerPoint. Don't know why these didn't copy over well. We have the flexor carpi radialis and flexor carpi ulnaris, as well as the palmaris longus. Again, those are stupid, they don't work. Okay, we also have radial and ulnar deviation. Now, in order to pull the wrist towards the pinky side or the thumb side, the radial or the ulnar side, we just simply use both sets of muscles on the radial side and both sets of muscles on the ulnar side. So for radial deviation, we have the flexor carpi radialis as well as the extensor carpi radialis longus and brevis. Because they say radialis, they are both on the radial side, and when they contract together, they pull the wrist into radial deviation. For ulnar deviation, we have the flexor carpi ulnaris and the extensor carpi ulnaris, both responsible when they contract at the same time to move the wrist into ulnar deviation.